Hello and welcome. This is a special show on coronavirus. You can call us on the numbers that is up on your screen and you can ask your questions. We have two experts with us this evening, Dr. Yatin Mehta, Chairman of Medanta Institute of Critical Care, and Dr. Vijay Hadda, Associate Professor of Pulmonary Medicine at All India Institute of Medical Sciences. Thank you, gentlemen, very much for being with us as we get the callers. Let me ask you the first question, Dr. Yatin Mehta. We've seen these pictures of thousands of migrant workers traveling to their hometowns, and there in those pictures, social distancing seems to be a distant idea. How big is a challenge that is in the fight against coronavirus?
It's a huge challenge because so far, I think whatever the actions government was taking were appropriate and timely, but this has come up as an unpleasant surprise because this will undo whatever everybody else is trying to make up for. And some solution needs to be found very quickly. And I'm sure the government will do something to fix this. But so many people congested together completely, damages whatever we are doing to control this pandemic. So I think this has to be done as an emergency measure. Government must do something to people and prevent the spread of the deadly virus all over the country.
Yes.
But also on humanitarian grounds, it must provide them food and shelter, the safety of isolation for 14 days before they let them go to their home places.
We have a first caller. Anamika is calling from Noida. Anamika, go ahead with your question.
Yeah, good evening, doctors. I just want to ask, even if two children are playing badminton or basketball in Society Park and are maintaining distance, how can we convince them that even this is risky?
First of all, is it risky if people are playing basketball or badminton and they are maintaining a distance between the two players? Is it advisable to do that? Not advisable? Dr. Vijay Hadda, why don't you take that?
Yeah, it's a very important question, but I think the important thing here is if somebody is carrying this disease, suppose one person is infected with COVID and he's coughing or sneezing, and whenever he coughs or sneezes, and if the virus come in contact with his or her hand,
yes,
and then subsequently, if that person is touching either the basketball or badminton racket or any other playing object, the virus can go to that object. And whenever the other person will touch that virus will be transferred to the other person. So there is definitely a risk, potential risk is there.
yes.
So this can be conveyed to the people who are involved in the playing that no, this is also a risk factor and we should avoid it as far as possible.
We should avoid it. There's a risk of infection spreading. Anamika, hope you can convince the kids not to play at this moment. We have another caller, Somanath from Bengaluru. Go ahead with your question.
Hello, sir.
Yes.
Yeah. As per the reports, there are 15 lakhs people who were screened at the port of entry, especially at the airports. And I understand that 80% of the people who have this COVID-19 confirmed or having that disease will not show any symptoms, which means that in our society, the disease is already hidden and this disease would have transferred or they would have infected the other people in the society. So how we can stay safe? Because currently we are under lockdown, and even if the lockdown is lifted, there will be the people who are unidentified, and it has been spread already.
All right. Somnath, we got essentially what you are asking. Dr. Yatin Mehta, why don't you take that question? Many of the people who may be the virus carriers may not show symptoms at the airport. So how do we stay safe is what Somnath is asking.
See, yeah, that's a very appropriate question. But the thing is that 14 days is the incubation period. So any people who are arriving before this lockdown, because now all the domestic rights have been stopped, were asked to remain for 14 days of self-quarantine either at their homes or in the hospital if they were sick. So that was one thing. 80 to 90% of the people who will be transmitting the disease may be symptomatic. So temperatures were checked and so on. Otherwise, some percentage of people will always escape. If you test them also.
Yes.
So that applies for any disease. That doesn't mean you don't test it. I think it's a good practice to test them for temperature and then isolate them. And anyway, at the moment, everything is stopped. So that takes care of that.
Right. We have another caller, Harjeet from Gurgaon. Harjeet, go ahead with your question.
Yeah. Hi, sir. Thank you for your service, sir. One question I would like to ask is what will happen after 14th April? And another thing, will there be like a 5-day back to normal phase and then again some quarantine? Or are we looking at total eradication or something like that till the 14th of April?
I think that's a government decision, but Dr. Vijay Hadda, if you could throw some light on that, what could happen after this lockdown ends? What next can we expect?
So I think first we should understand why this lockdown period is there. Because this virus is spreading in the community from one person to another. So what will happen? Ultimately, a large number of the patients will be there and they will put a stress over the healthcare system. So we know that the number of patients will keep on increasing with time, but we want that peak to be delayed as far as possible, or at least the curve can be flattened. So that will help in the healthcare system so that the healthcare system is capable enough to take care of all the patients who ultimately require maybe admission or maybe ICU care or something like that. So one thing is that. Second thing is this 14 days or 3 weeks period is taken, keeping in mind that at least this period is required, and probably it is not the last word. We have to see the situation. This is a very dynamic one.
Yes.
And after maybe weeks down the line, we will again reassess at maybe on 14th of April. We will see what is the situation, and accordingly, probably the government will take action, whether it can be completely relaxed or there should be some kind of restricted kind of movement, or I don't know at this point of time. But definitely, this war is still on, and we have long way to go. And 14th April, we will see where we are.
All right. Latif from Srinagar is calling. Latif, go ahead with your question.
Good evening, sir. My name is Latif Khan. I am calling from Srinagar.
Yes, go ahead.
Sir, can we take antibiotics in advance or any allergic drugs before any symptoms?
Can you repeat that question, Latif?
Sir, can we take antibiotics or any anti-allergic drugs in advance without symptoms?
Dr. Yatin Mehta, you want to take that? Should they take any antibiotics or anti-allergens in advance?
No, Latif, there is absolutely no role of either anti-allergic or antibiotic. In fact, it can mislead you. So please don't self-medicate, and there is no role of any of these medications.
Mr. Jogevara Rao from Hyderabad is calling. Mr. Rao, go ahead with your question.
Good evening, Rohit and doctors.
Yes.
Actually, I'm 60. With all respect, the experts are telling for the aged with the heart disease and having stents and hypertension and all these things. Actually, my query is on the basis of which these risk factors, the aged persons are at much risk is being discussed.
Yes.
On the basis of which data? Because in our country, still the mortality is only around 27, below 30 only. That cannot give you any this thing.
Right.
If it is other country, from other countries' statistics, whether it will be valid to ours. And I have a second question
Mr. Rao, we got essentially what you are asking. Dr. Hadda, would you like to take that? Under what research, what data are we concluding that people with underlying conditions like hypertension and people who are above 60, for example, are at greater risk?
Sure. So this information, whatever we have got regarding risk factors which are associated with worse outcomes, is from published data, and this data was from China. Basically, whatever steps we are taking, it is based on experience in China. So in that study, they have shown that the people who are having age more than 65 years of age, and especially 60 to 79, if we say precisely, the mortality was 7%. In the same study, if we take patients who are more than 80 years, suddenly the mortality rate goes double, 15%. So from there we take this age cutoff of more than 60 years. Similarly, in the same study, they have found that the patients who are having other comorbid conditions like lung diseases or kidney diseases, liver diseases, or uncontrolled diabetes, or similar like other diseases who are uncontrolled especially. So those patients were at increased risk of adverse outcome. Theoretically, he's right that we have no data from our population, but that is true for other diseases also. Most of the time, we interpret this risk factor from other countries if there is no data from our country.
Right. Deepanika from Kolkata is calling. Deepanika, go ahead with your question.
Yes, sir. If we have a mild fever, say 100 degrees, and no other symptoms or mild throat pain, so in that case, what do we do? Because we are not getting doctors. Okay.
Dr. Mehta, would you like to take that?
Sure. See, if you are in the higher risk category, that means if you have traveled recently abroad, or if you come in contact with somebody who had a high degree of suspicion or a confirmed case of COVID-19, then immediately you should show to a doctor nearby. Even otherwise, I think, although at the moment ICMR says that there is no evidence of community spread of the disease, but still, in view of the increasing numbers, I think I would advise you to show to a local doctor. If doctors are not available, your local GP is not available, you can easily go to a nearby hospital, and I'm sure they'll take care of it.
We have another caller, Munir from Srinagar is calling. Munir, go ahead with your question.
Yeah, my question is regarding the issue which we right now are facing in Srinagar, is that some suspected patients who are fleeing away from the quarantine centers because they complain about some infrastructural facilities. So my question is, isn't it the responsibility of hospital or the quarantine staff to do a bit of counseling when they are admitted over there, so that they make them aware of the fact that they being quarantined is very important, and make them feel at ease, because attendants cannot visit them as they are not allowed to see them. So what is the responsibility of the medical staff?
Right. Dr. Hada, will you like to take that? People fleeing these quarantine facilities, it's really a huge challenge. What is the responsibility of the medical staff? Should they counsel these patients when they are coming in?
Sure. So wherever these facilities are there, I think doctors, paramedics and other staff, they are, I think, committed. They are doing counseling also for patients regarding the need of quarantine. But I think along with doctors or paramedics, it is the responsibility of a patient also, or as a society, that we should be aware about this, because if we go out, there is a chance that we will give this infection to others. So I think not only the hospital or medical staff, it is the responsibility of the person also. But again, I would suggest that the medical staff may be slightly more vigilant. They can give more time to the patient for counseling. And if we can counsel properly, then I think this kind of thing will not happen.
Right. Nisar Ahmed from Bandipora is calling. Nisar, what's your question?
Hello, good evening, sir.
Yes.
I am Nisar speaking from Bandipora. I think currently in this Kashmir, Bandipora is the hotbed of this COVID-19 right now. So there's a general perception prevailing among the masses that there's a correlation between the rising temperatures and the prevalence of the pathogen. Do we have any published data which says that with the rising temperatures, the pathogen is going to die its own death?
Dr. Mehta, is there any evidence of with the rising temperatures, will the coronavirus subside?
See, as far as I know, there are only 4 confirmed cases in Kashmir. So even if Bandipora has this thing, it is not a matter of that major a concern. Regarding temperature and all, it is wishful thinking. There is no scientific evidence at the moment that the virus dies at a temperature of more than 20 or 25 degrees centigrade.
Yes.
This disease does happen in tropical countries also. So really, at the moment, it's wishful thinking, and I hope that is true, but there is no real evidence for that.
All right. Now, Anup Mehrotra is calling from Noida. Anup, go ahead with your question.
Yeah, hi. My question is that Dr. Rajiv mentioned about, the peak is about to come. So my question is that, when whatever measures we are taking, how do we define peak and how worse it can be?
Dr. Hadda, would you like to take that?
Sure. Actually, it's very difficult to predict at this point of time because we have taken some steps like this lockdown. So we should understand that the infection is going to spread from one person to another one. So if we can curtail that spread, means if we can identify a person at time and then we can quarantine that, then chances of spread to other person will be less. So that is the only way we can stop this peak, or we can at least bring that peak down. So I think that is the only step. And how much it will go, it will all depend on our efforts from society as well as from the government. So at this point of time, I cannot predict the peak.
Right. We have Jill from Cochin calling. Jill, what's your question?
Yeah, my question is good evening, Mr. Rohit. I appreciate NDTV for giving this session for the viewers. My question is,
Jill, can you put your television on mute and ask your question, please?
My question is, when we receive... my question is, when we receive materials like groceries and all that, when we receive at home, is it how we can disinfect from the virus? Like if we put it on the sunlight, sun heat, is it can we able to kill these viruses?
Dr. Mehta, will you take that question? How can we disinfect the groceries that we are getting home?
Yeah, sure. I think we are little overreacting. It is not that the infection is going to spread like that, but you can just, the sunlight has probably no role in cleaning or sterilizing exterior of the bags. You can just clean the bags with some disinfectant. Otherwise, I don't think there is really any major issue regarding the groceries. No. And wash your vegetables properly and all that.
Yes, yes. All right. I'm afraid that's all the time we have on this show. Thank you, Dr. Yatin Mehta and Dr. Vijay Hadda, for taking our viewers' queries. Thanks very much for joining us. Well, that's it on this show. Thanks for watching. Goodbye.